Hi, I'm product trainer Ken.
And I'm dental assistant Kaya.
Today we're going to be talking about bonding orthodontic brackets using Opal Etch and Opal Seal. But before we get into that, all of our videos are for informational purposes only, not a substitute for professional training. We don't guarantee any accuracy, and you use our content at your own risk. We're not liable for any damages. Seek qualified professionals for training and certification. Don't rely solely on our videos. Our videos are for learning, not certification. Enroll in accredited programs for comprehensive training. Content may change without notice. So just in terms of bonding, we're going to use the Opal Seal and Opal Etch. We've obviously got the patient isolated, the teeth are dried. We start with Opal Etch.
So when we start with the etch, you're going to want to grab it, remove the cap, and place your tip on. And you just screw it in. And then you're ready to apply. You just have to pump or push down as much as you need. Sometimes it comes out a little fast. And that's about all you'll need for 2 to 3 teeth. After each time you bond a patient, you're going to want to remove the tip and place the cap back on, and then clean your area.
Yes, these are a one-time use. So once you're done using these, they get thrown away.
So when you're done etching and you want to apply the bond, you will do the exact same thing, remove the cap and place the brush tip on, and then you're just going to give it a little push, and that's about as much as you'll need for...
You can see it right there.
Yeah.
That'll get you started for about 3 to 4 teeth.
And same thing as the etch. Once you're done with the bond, you'll remove the tip, place the cap back on, and clean your area.
So a very key aspect to both of these products with the Opal Etch and the Opal Seal, we want, when we apply it, which you'll see in a second, you want to keep the layer very, very thin on the tooth. Okay, a very thin layer of etch and a very thin layer of Opal Seal. Essentially what you do with the etch, you're going to actually do with the seal as well. Okay, just a very thin layer, and you'll see Kaya do that in a second, but keep both products on the tooth very, very, very thin.
Alright, so once you're ready to start prepping the tooth, you're going to grab your etch and just start placing the etch on the tooth using swipe down motions, starting at the gingival, going down to the tip of the tooth.
Keep in mind, we're not rubbing the tooth. This is just, like Kaya said, it's a swiping motion downwards from gingival to occlusal. Just a nice swiping motion. This should be done very quickly. The etch is going to sit on the tooth for probably 15 to 30 seconds. You just want that nice light layer of like a baby blue look to that tooth. This process should be very quick in the mouth. There's no reason to leave the mouth. You could just go tooth to tooth and you can kind of see the entire arch, a very consistent light blue, a very thin layer of etch.
So once you've left the etch on for about 30 seconds, then you're going to rinse the whole mouth with your water and your suction. After you've rinsed all of the product off, then you're going to go in with your hairs and re-dry the whole mouth.
From this point, the tooth should have a nice, dry, chalky look to it. Every tooth. From that point, it should be nice and chalky. You want to give a nice, quick air dry to make sure everything is ready for the primer.
Alright, so once you've etched, rinsed, and dried your patient's mouth, then you will grab your Opal Seal. You'll just create a little dot. And again, with that swiping motion, you're going to go down from the gingival across the whole tooth.
Very important to remember, this is a very, very thin layer. Once you have a chalky tooth appearance, all this is doing is wetting the tooth, making it a little shiny, but you keep it very, very, very thin, like Kai is doing.
When you're swiping, you want to avoid continuously going back and forth. You just kind of want to swipe the tooth.
Yes,
and
we
be
don't
done.
We don't want swirls. We don't want back and forth, ups and downs. We just want a nice swipe. Once you do swirls or you do different directions, you create ridges in there, and that could accumulate plaque in there. So we just want nice straight lines from gingival margin or gingiva down to the occlusal edge. And again, using the tip, there's no need to leave the mouth. You can do an entire arch at the same time. You don't have to go back and forth.
So once you're done placing the opal seal, you're going to want to air dry the teeth, and then you check with your ultraviolet light just to make sure that all the teeth are covered and that they look more white.
Checking for fluorescence.
So after the opal seal is on, you're going to air dry your teeth.
With opal seal, the crucial component is when you air dry, like Kaya did, we're not air drying to thin out the opal seal. We're just air drying to get the ethanol to evaporate out of the opal seal. So if the field was wet, this will help get it completely dry. We're not doing it to thin out the opal seal. We're just doing it to dry it and get it ready for the brackets.
So once your tooth is prepped, then you're ready to place the brackets, which we'll show in another video.
If there is delay for getting the brackets on the tooth, and moisture just does get on the teeth, do not reapply opal seal. Do not reapply, just get it air dry. So if it takes a little time for doc to get there to get the brackets on and saliva gets on in the enamel, just air dry it. Do not reapply opal seal. Just keep it dry.